Hello, doctors. Good evening. And today I would like to talk about a very interesting and important topic where many of the specialist doctors, like you can be an ophthalmologist, you can be a endocrinologist, you can be a gynecologist, and you want to work together with a multi-specialty hospital. And in this scenario, how do you actually form the collaboration? How do you form work together with them? And what are all the various aspects which has to be taken care? We will be covering this in this 10 minutes video today. And thank you very much for all your support to our previous videos. And let me start with a small presentation. So how can specialists collaborate with multi-specialty hospitals is going to be the topic of discussion today. And various time we are as a specialist, we want to work, we may be practicing individually, but we also want to participate and collaborate with a nearby multi-specialty hospital. So what are the reasons for which one should collaborate? So maybe there is a multi-specialty hospital which doesn't have an ophthalmologist or which doesn't have an endocrinologist. So the hospital might take you on an employment. They say like, okay, you come for 4 5 hours every day, and then you get a salary for that. You see all the patients there. It's a very simple kind of a contract with the multi-specialty hospital. The second thing which you will be, second way of collaborating with the multi-speciality is you are already having a center, but you want to have an additional secondary center in a multi-speciality hospital. So that is where you will want to establish a additional center in a multi-speciality hospital where majority of the times you have to be working out a partnership arrangement with them. And maybe you have your own hospital, but you don't have insurances. So you want to tie up with a multi-specialty hospital for the purpose of insurance. And fourth thing, there may be some schemes like this Ayushman Bharat and all these schemes where because you are not having these schemes in your hospital, you want to work out with the multi-specialty hospital. So these are the four major reasons where you want to collaborate with the multi-specialty hospital. So then comes the investment. When you are establishing a department in a multi-specialty hospital, who is going to do the investment for the OPD and who is going to do the investment for the OT and other. So a smaller specialty like pediatrics doesn't need too much of investment, but a specialty like ophthalmology, a specialty like neurosurgery, a specialty like cardiology might need a lot of investment for this. So who is going to do the investment, whether it is going to be done by the hospital or whether it's going to be done by the specialist doctor? So there are either ways, but based on who does the investment, it is important to have that kind of a revenue sharing arrangement. But generally, I would suggest you make the multi-specialty hospital do the investment, but majority of the time they will not do the investment. So you have to work out a partnership arrangement with them. Second thing is staff. Staff for OPD, staff for OT. Is it going to be by the hospital or by the specialist doctor? So that is also something important to consider. So for the OT, maybe the multi-specialty hospital might already be having staff. So you don't have to additionally appoint a staff. But for example, if you're appointing OP, if you're running a OPD in a multi-specialty like an ophthalmology OP, and I think then you might have a specialist staff required, like an optometrist or an optician, which you might have to appoint. So this also you have to very clear cut work in the beginning of the partnership with the multi-specialty hospital. So what are all the areas where revenue can be generated? The revenues can be generated from multiple sources. One is OPD. So there is a OPD consultation fees paid by the patient. So then there can be investigations like, see, if you're an ophthalmologist, there is a scan, then there is OCT, there is field. All those investigations can generate revenues. The third important part of a revenue generation is OT. So when you're doing surgeries in that multi-specialty hospital, there can be revenue generated. And additional revenue can also be generated from pharmacy and opticals. And when your patients are getting admitted inside the multi-specialty, the inpatient revenue and maybe some specialties might also generate revenue from ICUs. So these are the 6 areas where the revenues are generated in a multi-specialty hospital when you are going to collaborate or partner with them. So next question naturally comes is, how do I share the revenues? So basically, let's say from the OPD area, majority of the revenue comes to the specialist doctor. So in terms of OPD, let's say 60 to 90%, if you're getting 100 rupees as consultation, 60 rupees to 90 rupees goes to the specialist doctor, and a small percentage, 10 to 40 rupees, goes to the hospital. On the other hand, surgery, let's say you're doing a cataract surgery. So generally, the way to calculate the revenues, you take out the cost of the consumables. If actual consumable cost is, say, cost of a cataract surgery is 10,000 rupees, for example, cost of consumable is 3,000. So the balance 7,000, here also majority, a major share goes to the surgeon. So 60% goes to the surgeon, 40% goes to the hospital, or 70% goes to the surgeon, 30% goes to the hospital. And in terms of investigations, this depends on who invests for the equipment. If the equipment is being invested by the multi-specialty hospital, then the doctor or the specialist doctor gets a lower share in the revenue, say 20% or 40%. But if the equipment is being invested by the multi-specialty hospital, then the equation can reverse. So majority, let's say 60 to 80% comes to the doctor, and then 20 to 40% goes to the hospital. So in terms of IP and inpatient and ICU, it depends. Majority of the multi-specialty would want to retain that revenue 100% to them. Same will happen in pharmacy. But in terms of opticals, for example, because this is contributed by the ophthalmologist, maybe a small revenue share can be accrued to the ophthalmologist. So basically, the revenue share arrangement has to be worked out with the multi-specialty hospital in the initial stages only, and then this has to be clearly worked out, because I know many doctors don't get into a very clear revenue share arrangement, and then after some time there is a conflict, and then it leads to a lot of difficulties once you don't have a clear-cut arrangement on the revenue sharing. So this is a gross analysis of revenue sharing based on many of the doctors who work in various multi-specialty hospitals. How do they share the revenues with the hospital, so that the hospital also, there is a win-win situation. At the end of the day, I think we should be aiming to create win-win situation where the hospital is also happy, the specialist is also happy. So that is also very important. So what are the important points to consider? One thing is many times the rights and responsibilities of each partner, each party. What is the right of the multi-specialty? What is the right and responsibility of the specialist doctor? So let's say if you are investing, if you're going to invest your money, time, and everything in the hospital, I think the first important thing we have to ask is, you have to be in charge of that particular department. For example, ophthalmology department, it has been given to you, meaning you will be in charge of the ophthalmology department and nobody else. The multi-speciality should not take any decisions with regard to ophthalmology department, like appointing an ophthalmologist or conducting a camp or doing anything without your own your concurrence. Because this is very important, because I've seen incidences where a doctor will, let's say a neurologist will work in take the department. He will invest for the money and equipments, everything. But on the other hand, the hospital also bring another neurologist. With this will lead to clash. So you have to have a very clear-cut arrangement saying that as long as the partnership is there, it is going to be the department, you will be in charge for the department, and you will take all the decisions in relationship to that particular department. And many times our doctors also make mistakes when they are having this memorandum of understanding or an agreement with the collaboration. It has to be a very clear memorandum which has to be drafted with the help of a lawyer, so that there is no clash in future. And also you have to create a long-term MOU. It should not be a short-term. The MOU should be for a long term, at least for a period of 3, 5, 10 years, so that if you're particularly if you're investing for equipments, you have to make sure that there is a long-term partnership agreement for you, where all the rights of both the parties are preserved. It is important to have this MOU drafted very well, understood very well. And if you are thinking of partnering with a multi-specialty hospital, and if you want us to support you with the MOU or provide you with some sample MOUs or with the lawyer support, we will be very more than happy to help you out with this collaboration. So make sure that you spend a little bit amount of time, and there is a little bit amount of money which is also spent to create a very foolproof MOU when you're partnering with a multi-specialty hospital. So these are my contact information if you want to get in touch with me. And I'm sure this video has created that awareness. How do you actually collaborate with the multi-specialty hospital? I didn't want it to be a very long video. And if you have any questions, please do connect to me in person and we can have a discussion. And if you are also interested to have some more topics on these practice management related topics, please do get in touch. And I will also like to invite you all for our conference in December 6, 7, 8 at Hyderabad. It is called Health All, where we will be having various workshops focusing on practice management. And I would be sharing the website in the description for registration of Health All, and looking forward to more interaction with all of you. Thank you, and we will meet in another video soon. Thank you.